Hi, everybody. Thanks for joining us. We're going to get started in just a few minutes. We're just waiting for a few more people to log on, so just bear with us. But thank you for being here. Hi, Lenise. Thanks for using the chat box. Hi, Eugene. Thank you for being on with us. Hey, Melissa. In the chat box, can you just guys let me know if you see the first PowerPoint slide? I want to make sure I'm sharing the right screen. Okay, thank you. Hey, Nina. I know we switched the time today, so I just want to give everybody a few minutes to log on. Oh, hi, Ava. Melissa, I think we're going to have to do a session where we have everyone's kids join on with us. I think I'll like that. Say hi to all the babies. It looks like a couple more people are still having some login issues, so I'm just going to give them another minute or so. Thank you for everybody who is on with us on time. Sorry for the wait. Hope everyone likes my background. We're going to pretend we're in San Francisco. I think we could all use a nice little vacation. All right, it looks like our number is pretty steady, so we will get started. Thank you, everybody, for joining us. Just to give a little bit of an overview, if this is the first time you've been on our weekly updates, our main objectives on why we're doing these every week is to just keep everybody updated with the current precautions and communication plans that we have agency-wide, any program-specific changes and updates to things, any frequently asked questions that we notice we're getting, so we make sure that everyone's getting the same info across the agency, because we know that things are very fluid and changing minute by minute. And any potential expectations we think that we can kind of foresee coming, to make sure we're transparent with everybody. This is just outlining our priorities, our health and safety for our workforce and the people we support, the continuity of supports and services, continuity and stability of employment, consistent and transparent communication. And these are our priorities always, but of course, we want to make sure that we are reiterating them during such a trying time like now. And I noticed that I keep looking to the side because the PowerPoint's over here and the camera's over here, so sorry about that. So just a reminder, I know that some of our DSPs had responded back like, oh, I don't know if I'll be able to make it today because I'm working. If the person you support is interested in coming on these webinars, we would love to have them. These webinars are open to absolutely everybody. It's not just our administrative employees. It's open to people we support, our direct support professionals, our community partners, families of the people we support, really whoever needs to be kind of in the loop with things that are going on with PCCS. So we're going to start with just some reminders about things going on. Not a lot of this is new over the next few slides. We just want to make sure everyone still has the information. So we are doing a poetry contest. The first place winner receives $75, second place is $50, and third place is $25, and these are cash gift cards. So if you are interested in doing this with us, please make sure you send your poetry by May 15th to Alyssa D'Augusto, and her email is listed here, and that flyer will be sent out when we send out the weekly updates on Friday as well. I just wanted to remind everybody that we do have a YouTube page. So in addition to the weekly webinars that we're doing, these are being recorded and they're being put on YouTube, but there are also some other things on there, and we're going to be adding some additional training content. So one of the ones that I found really helpful is how to support someone with intellectual disability or developmental disability during COVID-19. So it goes through how to provide direct service while also being socially distant and so on and so forth. It talks about telehealth and some best practices around that. So I just wanted to remind everyone that that is there. Our employee support group, I believe the next session is actually tomorrow. So please feel free to join us May 7th at 12 p.m. This flyer will also be sent out to everybody if you don't already have it. If you have any questions at all, please email covidsupport@pccsny.org about registering or how to join or that kind of thing. It's through Zoom, but you can join by video or by phone. And the topic tomorrow will be Tiger King. This is also just a reminder, we sent this out last week, but we just want to make sure everyone has the resource if they need it. This is a totally virtual service. This isn't something that PCCS is providing. We just thought it would be helpful to share with you guys. Project Hospitality, which is a Staten Island agency that does a variety of social services, joined with NYC Consumer and Worker Protection to do free tax prep for people within certain income brackets. So feel free to reach out to them if you still need to get your taxes done. It is open through June 30th. Just another plug, and I know I've been talking about this every week, so I'm sorry if you keep hearing it, but I'm probably going to keep saying it. We were able to work with our insurance company about getting free exercise classes digitally for all of our employees, so that is here. One thing we've heard a lot from the medical field is that a preventative to keeping yourself safe and healthy is to exercise and increase your lung capacity. So I know I myself have taken up exercise over these last few weeks. As much as I am not a big exercise person, I'm now doing it to make sure that I am safe and healthy. So this is open to all of our employees. You can also do it with the person you're supporting. So please make sure that you're sharing this around, and the sign up is pretty easy and they have tons of classes. So a new and fun thing that is going on, Evelise Segara and Kevin Roman are organizing a PCCS kind of parade drive around. So that'll happen on May 15th at 12 p.m. If you're interested in joining us, please email Kevin Roman, kroman@pccsny.org, and they'll give you more of the info on where everyone's meeting and the exact locations of where everyone's going. But feel free to get creative with your car decorations and your signs. Hopefully it'll be a fun time for all of us to sort of socially distant connect with one another. Probably a lot of beeping, so you might want headphones or something too. We did want to give you guys an update on some of our advocacy efforts in order to make sure that we are sharing with the community all the amazing work that you guys do. We partnered with a photographer from Staten Island, Megan Crapizano. Hopefully I'm pronouncing her name right. And she is looking for people we support, the direct support professionals, our administrative staff. She really is looking to capture pictures of what a day in your life looks like. And so it could be pictures of, she might come and be there while you're supporting someone and take pictures of what that looks like. Maybe virtual team meetings. I don't know if she would be on them to take pictures or how exactly that would work, but Kevin is working with her to schedule that and get that together so we can really showcase the amazing work that everybody is doing. So if you're interested in being a part of that, please also reach out to Kevin Roman. His email address is kroman@pccsny.org. This is an amazing partnership that Alyssa D'Augusto worked out with Ink Couture, which is a tattoo shop on Staten Island. So the fundraiser that you guys were seeing on Facebook and that we've been talking about to be able to give all of our DSPs a $50 food gift card so they can food shop at Bayer's Market. That's still available. So if you're interested in that, please reach out to the COVID questions email and we'll arrange that. But please also share this fundraiser. What Ink Couture did was they gave us a $1,000 gift card to raffle off. So if you donate $25 or more, you will be automatically entered into that raffle. So the links are here. You can donate on either Facebook or our website as well. So please share that widely. And just a reminder, as we're going through any of this stuff, if anyone has any questions, please feel free to type it into the chat box and I will do my best to answer them. So some of the sort of new business, and I want to make this really transparent that this is for all of the people connected to PCCS. So we don't just want feedback from our administrative employees. I really hope to hear from a lot of people we support, a lot of DSPs, our community members, our families that are connected with us. We are in the middle of redoing our strategic plan, and we're working on something called a SWOT analysis. So a SWOT analysis is something that helps an agency look at their strengths, weaknesses, where there's room for opportunities, and where there's some threats towards the agency. So this Word document will be sent out on Friday. If you can please send it back to me, I'd love to hear your feedback about, things we're doing well, things we can do better, and some areas, where you feel like we have opportunities or some things that you feel like might be negatively impacting us and we could do a bit better. So I threw in some examples in here. So an example, and these are all from my perspective, so you may or may not agree with them, and that's why we'd love to hear your feedback. Some of the examples from my perspective are a strength of ours is we have very transparent and frequent communication. A weakness of ours is I feel like even though we communicate a lot, there's that we have difficulty in retaining some of the information that's communicated and being consistent with information across departments. Where I feel like we have some room for growth and opportunities is we have a workforce that is really adaptable and resilient to change. Where I feel like there are some threats is our direct support workforce, and a lot of the people we support or the families that are connected to us don't seem to engage with us a lot, whether it be through things like this. I think these weekly webinars are a perfect example of that threat. We have about 520 employees and we service about 600 people, and we've never had more than 50 people on these webinars. So that just goes to show you that although our efforts are there, we still have some room to grow in terms of making sure that they're meaningful and then making sure that people are really actively engaged and getting the information that they need. So those are just some things from my perspective, but again, I would love to hear yours, and we really want to make sure that your point of view is included in our planning process for the agency. So along with, I'm sure a lot of people have been seeing Cuomo's live updates and his discussions about reimagining what workplaces look like. And so that's what we're in the process of trying to do. The first phase to that is really surveying and hearing from you guys how our remote operations have impacted you, whether positively and negatively, neutrally, or a mixture of all of the above. So we will be sending out this survey on SurveyMonkey. It should take you no more than maybe a minute or two to fill out. It's just some quick questions. We really just want to make sure that as we start to plan to come back into the office and reimagine what this all looks like, that it's something that works for everybody. So everybody meaning the people that we support, the families that are connected to us, our direct support professionals, and our administrators. So you will get this survey. The link will open up. You can do it from your cell phone. You can do it from a desktop, whatever's convenient for you. And it's really just assessing the remote capabilities and in order to implement a plan for phasing back. And we want to be very transparent. We do not have a full plan for phasing back into the office right now. We definitely do not want to just kind of flip a switch and say, okay, we're back to, business as usual. We want to make sure we're doing our best to keep everybody safe. But at the same time, we want to make sure that if our operations stay with a modification of being more remote than they used to be, that it's still successful for everybody, that DSPs are still able to reach their supervisors and get the training they need, and in-person meetings are still able to happen in a safe way. And this is our way to really hear from you guys about that. So this is just a little bit of what this survey will look like. When you click into the survey, you'll be asked for your name, and the survey is split up into 3 different areas. So if you're an administrative employee, and typically that means if you are have a desk space at PCCS and you're typically working out of Granite Avenue, if you're a DSP or a community-based employee, because we do have different titles for the role of a direct support professional. So a DSP, a life coach, a self-hired direct support professional, sort of any of the varieties of job titles for direct service work. And then if you're a person that we support or a family member of a person that we support. So it's split up into 3 different categories because we're phrasing questions from 3 different perspectives. So we really hope that you guys give us your feedback on that. You will be receiving the link through email, and you'll also be getting a text message. So Nina, I'll be sending you the link. That way you can just click it right from your phone. Does anybody have any questions about the surveying or anything they want to share about us trying to plan to come back into the office before we move on? I'll give everybody just a second. Thanks, Nina. All right, it looks like we are all good. If nobody has any more questions, that is all of the updates that we have for right now. Craig also just wrote in, so Craig Happel is an administrative employee in our quality management department. I'm sorry, Craig, I'm blanking on your title at this moment. But he said if anybody needs help with the survey, he can help you with that. Craig helped me set it up. Thank you. Craig is the quality management support specialist. So if anyone needs help with that, please feel free to email Craig and he'll work you through that. Just a reminder, all of our calls have moved from 12 p.m. to 4 p.m. We did hear from some families that 12 p.m. was not a good time if they were homeschooling. So we moved it to 4. So hopefully we have more families that are joining on with us. And I hope that all of our program supervisors and coordinators that are on with us now, if you don't see your families joining on with us, please encourage them to join on with us and get engaged in these. That way we can make sure we're hearing their feedback. And it's really important that we hear from them for the SWOT analysis or for the survey about our operations that we're going to send out. So if they don't send it to me directly, I will be sending you guys a list of who I don't have it from and ask you to do some outreach to make sure that we hear from everybody across the board. As always, if you guys have any questions at all, please feel free to email me directly at alexa@pccsny.org or use our COVID questions at pccsny.org. And that way we can make sure we get any of your questions answered on these weekly calls. And whoever's been with us on these before knows that I like to end off with a nice little quote. So I just want to remind everyone that even though the weather is getting a little bit nicer and we feel like we can loosen up on some of the restrictions, please be careful and just make sure that we're being safe and being strong. And I really liked this quote, "Be strong because things will get better. It may be stormy now, but it doesn't rain forever." So with that, that's kind of all we have for today, unless anyone has any questions. But thank you guys for joining us. I'll stick around for another minute or so if anyone wants to type anything in. But I really appreciate you guys being here and all the hard work that you're doing. It's been pretty amazing to work with you all. Oh, thank you, Kathleen. I didn't know you could do a thumbs up. That's cool. Oh, thanks, Sasha. I'm glad you like that quote. Perfect. It looks like we're all good. Well, I hope everyone is staying safe and healthy and being careful, and hopefully we'll see each other soon. Bye, guys.